Hey everyone. I can't seem to find a way to record on Zoom or Google Meet, so I am going to improvise. So, if everybody could open up the slide presentation, and we'll start on slide one. Um, and the presentation is called The Effects of Alcohol on Humans by John Williams. And then, if you could proceed to slide two, the question is, what is alcohol? And here I have a picture of the structural makeup of alcohol. So alcohol has been around for thousands of years. Humans have used fruits, honey, rice, other fermented grains for the purpose of creating and consuming alcoholic beverages. And then reverting back to the image on the structural level, we see it is made up of C2H5OH, which is two carbon atoms, five hydrogen atoms, and a hydroxyl group at the end of the two carbon chain. And this hydroxyl group is distinct to the makeup of all alcohols. So if you proceed to slide 3, the question is, how does alcohol affect the nervous system on the cellular level? As we know, alcohol is a central nervous system depressant, and it acts on various sites and affects brain function in a multitude of ways. Two of the big neurochemical effects that alcohol has on our system is through the GABA system and the glutamate system. The GABA neurotransmitter is the major inhibitory transmitter in the central nervous system, and when affected by alcohol, it causes sedation. Glutamate is the major excitatory transmitter, and its job is potentiation, which is the neuron's ability to respond to neurotransmitters. And alcohol interrupts its ability to do so. And if you now proceed to slide 4, the question is, how does alcohol interact with the peripheral nervous system? And if we reference our textbooks, we know that the peripheral nervous system is all the processes outside of the brain and spinal cord. Peripheral neuropathy is common in excessive drinkers as a result of thiamine deficiency and malnutrition. This presents itself as pain, burning, and numbness. Another side effect is liver disease. Liver disease actually can disrupt our neurotransmitters in the brain because toxins are not being properly expelled from our blood due to fat buildup, inflammation, scarring in the liver. So if you proceed to slide 5, we're going to go over a few of the neurological diseases. The first one is the Wernicke-Korsakoff syndrome, or WKS. It is the combination of two different kinds of syndromes, Wernicke encephalopathy and Korsakoff psychosis. And similar to the liver disease, it's due to deficiency in nutrients like thiamine and B12. And is probably caused by the choice to drink alcohol rather than eat. Wernicke patients suffer from ocular motor paralysis, confusion, and poor coordination. Korsakoff psychosis shows itself after Wernicke and is characterized by forgetfulness, difficulty walking, and remembering new information. Alcoholic cerebellar degeneration, it's exactly how it sounds. It results from excessive drinking, and the neurons in the cerebellum actually begin to deteriorate and die. And what we know from our textbooks is that the cerebellum is responsible for coordination and balance, which makes sense because this condition results in jerky movements, tremors, and even slurred speech. The last one we're going to touch on is fetal alcohol spectrum disorder. And sadly, this disorder is to no fault of the victim's choices or behaviors. FASD occurs when people drink alcohol while they are pregnant. And sadly, some of the characteristics can be a lower number of brain cells, fewer neurons that function correctly, and their brains can actually be smaller. Because of this damage to the brain, this person does not get the chance to develop fully and will have cognitive and behavioral difficulties. And then if you go to the last slide is treatment. So treatment for alcohol disorders. Behavioral treatment is one option because of our understanding of neuroplasticity and knowing what we know about neurons and their capability to change and reorganize. For as long as we're alive, it's never too late for behavioral changes. It is even said that 2 weeks of abstinence from drinking, lost gray matter in the brain begins to regenerate. And there is no one size fits all for anybody, but some of the different suggestions are counseling, whether it's with like a substance abuse counselor, social worker, psychologist, just having support systems in place to support you through the behavior changes. Another option is synthetic medication. While it is always suggested to have synthetic medication in combination with some kind of communal or individual support from a professional. But I might butcher these names. There is acamprosate, and what that does is it blocks GABA and reduces NMDA receptor glutamate related excitation. This will have an effect on the calcium influx. And it could even have a neuroprotective role in the detoxification. This is to help with withdrawals and then hopefully spur some long-term abstinence. Another option is naltrexone. It helps people with their binge drinking. It antagonizes endogenous opioids such as B-endorphin and enkephalin. By blocking these opioid receptors, it reduces the enjoyable effects of alcohol, which would deter us from drinking. And lastly, there's disulfiram. It's a popular option. While I think it seems a bit masochistic, as its job is to literally create adverse effects that keep you from drinking. It'll induce nausea, vomiting, headaches, stuff like that. And the last one is the entheogenic treatment. That's going to be your mushrooms, your ayahuasca, stuff like that. And studies are coming out with the fungi that it actually reduces activity in the default mode network. And this is linked to our ego, social functioning, all that stuff that's kind of surrounded with alcohol. And these are supposed to kind of support a like ego dissolution, and then hopefully you can rewire and create new neural pathways as you reemerge from this experience. And that's it. I appreciate everybody for watching, and it's been a really fun year. And yeah, thanks again, everybody. Ciao.